Hello everyone. Hello Ma'am Paragas. My name is Christine May Dalang and I'm from BSN2 of our College of Our Lady of Mount Carmel. And today I'm going to do a return demonstration of proper way of administering a fleet enema. Okay? So by the way, of course, the first thing that we are going to do is to first check if there is an order provided by the primary healthcare provider in terms of providing a fleet enema. The second thing is to make sure that we gather all of the equipments that we'll be needing. So there are things that we need. Number one is, of course, the fleet enema. We will also be needing a bath blanket, absorbent pad, which you already put on the patient's bed. We will also be needing, of course, a paper towel, a pair of clean gloves. We will also be needing, of course, a lubricant, a water-soluble lubricant, and of course, I also have here an alcohol that I can use later on for hand washing, okay, or should I say hand hygiene, okay? And then it is also very necessary for us to have a commode or a bedpan ready for the patient, okay? So the next thing that we're going to do is to, of course, formulate our nursing diagnosis. So in this case, the patient's nursing diagnosis is constipation related to pain in defecation, secondary to hemorrhoids, as evidenced by being reported by the patient that she's unable to defecate for like 5 days now. Hard stools, pressure in her rectum, and at the same time pain in her hemorrhoids. Okay, of course, what we would like to have as an outcome is for the patient to defecate or to have a bowel movement before the discharge. Okay, so let's go ahead and proceed with the procedure. Okay, so the first thing that I'll do is, of course, to first prime. Okay, prime the enema. Okay, so we'll be needing like at least 500 ml to 1000 ml of warm water, or at least an enema solution. Okay, put it here. Okay, and of course prime and clamp, and then once it's primed, by the way, there's like a trash can here, and then once it's primed, then we can go ahead and first leave this behind. Okay, after that, of course, we are going to introduce ourselves to the patient. So, hi ma'am, my name is Christine. I'll be your student nurse for today. And then after we introduce ourselves, we are going to, of course, verify the patient's information, at least using 2 identifiers, like her name and at the same time her date of birth. Can I have your name, please? Can I also have your date of birth, ma'am? Thank you. So after doing such, we are now going to, of course, explain the procedure, how the procedure is being done, and of course, how the procedure is going to help the patient's condition. Okay, so after which we are going to, of course, make sure that we close the door, we provide privacy for the patient, we close the door, we close the curtain, okay, or we close the window. Okay, and at the same time, we also make sure that we have a bedpan, as what I've mentioned. I have a bedpan here. Let's just say this is a bedpan. We have to make sure that we have a bedpan ready. Okay, placed near the patient, especially if she is not ambulatory to the toilet. Okay, or let's say she's having a problem with controlling her sphincter. Okay, so after that, of course, we are going to do hand washing. Hand washing or hand hygiene, I should say. And of course, observe any infection control measures. Okay. Then after that, let me don on the clean gloves. The other one. And thereafter, we've done on our clean gloves. Of course, we are going to assist the patient on a lateral position. Okay? So we make sure that his right foot is slightly flexed. This will, of course, promote or help in the flow of the solution. So, hi sir, hello po. Sir, just put you po on a lateral position. Isa-side ko lang po kayo. And then later on, I'll be inserting something on your rectum. Okay? Thank you po. So, sir, tulungan niyo na lang po ako in 1, 2, 3. Thank you. Okay? And then using the bed blanket, we are going, of course, to cover the patient for him not to get cold and at the same time to provide privacy. So we make sure that we're only exposing the part that we're going to, of course, do the procedure on. So after that, of course, we are going to get the Enema tube, okay, put some water-soluble lubricant on it. And then, in a slowly and gentle manner, insert the tube in the patient's rectum, okay, about 3 to 4 inches, okay, in a direction of rectum going to the umbilicus. Okay, so sir, insert ko lang po ba? Hinga lang po kayo ng malalim. 1, 2, 3. Alright, so once you already have the tube inserted, the next thing we're gonna do is to first lower this down and then unclamp it slowly. And then put this back at least 12 to 18 inches above the patient's level. So we roll it up, okay? We roll up the Enema bag as the fluid is being instilled. And then we just wait. We monitor the patient for any signs of pain or any complaints from the patient. If the patient, for example, is explaining like pain or any discomfort, or all we have to do is just to clamp the procedure, the Enema, and then wait for like 30 seconds before we rush free. Okay? So let's just pretend that the Enema is done. Okay? The administrative Enema is done. So all we have to do is just to get paper towel. Okay. And then let's cover this. Remove our gloves. Of course, we do hand hygiene again. We, of course, position the patient back. Ma'am, position ko lang po kayo ulit. In a comfortable position, and then wait for like 5 to 15 minutes, okay? And ask the patient to tell us right away if in case she's having this urge to defecate, okay? And then afterwards, of course, we are going to help the patient go to the bathroom, or if in case she's not ambulatory, then at least we have the bedpan ready on the bedside of the patient, okay? So of course, after that, we are going to document the procedures that we have done, okay? So we are going to document, for example, if in case the location has swelling, has redness, or has excoriation. If the patient is having an episiotomy, we're also going to check if there is an edema, inflammation present, if there is like separation or presence of hematoma. And if there's like a discharge, we are going to note the amount, the color, and of course the odor of the discharge. And lastly, we are also going to document the patient's tolerance towards the procedure. So basically, that's it for administering fleet Enema. I hope that you've learned something. Thank you so much for watching today's video, and I hope you all have a great day. Thank you.